Hi, Dr. Blessing here again. So I'm going to be telling you a bit about conduct disorder. Again, these videos are for academic and educational purposes only, rather than for medical advice or to educate the general public. Okay, and these are not the typical things we do in clinical practice. So this is quite academic, and I would like you to treat it as such. Okay, so in the cask station where you have history taking about a patient that's got conduct disorder, what happens is you have your patient. Let's say the patient is Pete. I usually use Pete. I have a preference for the name Pete. So they're usually like an older child. So you'd have typically you'd have like a teenage boy, teenage male. So you'd have something like the school counselor requesting that it comes in. Um so you'd have history of him threatening like his school peers, and recently involved in something like a theft. And then the school counselor would advise that he needs further assessment and management. So you would essentially be speaking to his mom. So let's say Pete's mom, let's say her name is Samantha. Okay, so you get there, you're supposed to take a history to arrive at a diagnosis. And you know that our usual assessments in clinic would take at least an hour for a new patient. But in the exam, you don't have that much time. You have just a few minutes, so you'd have to ask the essential questions, and you'd not be able to take a full history. That's why I said this is not for the general public. This is aimed at doctors preparing for exams. So you'd have a very concerned mom. Should be shocked to hear that her son has recently been involved in a theft, and should be wondering if he's mixing with bad company, and should have noted his cruelty towards animals, and she would have said she has noticed something similar when he was in junior school.